Hello, I'm Dr. Aniketh Venkataram, Consultant Plastic and Aesthetic Surgeon at the Venkat Center for Aesthetic Health, Bangalore. Are you someone who's lost a lot of weight, either with workout or with surgery such as bariatric surgery, but now you're left with all this loose, saggy skin, and it's a painful reminder of what you used to be. Even though you feel different, you have this kind of loose skin. What are the plastic surgery options after massive weight loss, specifically a procedure called the body lift? Now, losing a lot of weight is not easy. Doing it with diet and exercise is not easy. Doing it with surgery is also not easy. The surgery to reduce weight is called bariatric surgery, which includes various techniques. Now, either way, you can lose a lot of weight, 20, 30, 40 kilos. We have seen people who are 120 kilos who come down to 80 kilos. And that is fantastic. People feel better, they're able to move on with their life, they're able to do things they were never able to do before. But unfortunately, there is usually one thing holding them back. And that is, while all the fat might have gone, all the skin hasn't gone away. So they are an 80 kilogram person living inside the skin of a 120 kilogram person. Because when you exercise, you lose fat, you don't lose skin. And this loose skin, one, doesn't look very nice, particularly if you want to go out in the beach, things like that. Second, it doesn't feel very nice. When you're working out, when you're running, you have these flaps of skin that are kind of flapping around. So what do we do for this? So this is what is called as post-weight loss plastic surgery. And very simply, these surgeries involve removing all this loose skin. So what are these procedures? Well, the foundation, the most important one of these is something called a body lift. This is where we remove a piece of skin all around the abdomen, 360 degrees. So all the loose skin all around the abdomen is removed. This is done for the abdomen. Other areas that we treat are the chest. In women, the breasts are very, very saggy. We do a breast lift. In men, the nipples are quite low and hanging. We do something called a chest lift. For the inner thighs, we do a thigh lift wherein loose skin is removed in the inner thighs. For the arms, we do an arm lift wherein skin is removed in the arms. Now, not everyone needs all of these procedures. Every person is different. For some people, only a body lift is needed. Some people need some combination of. Now, are all these surgeries done together? No, they are staged. Typically, there are 3-month gaps in between surgeries. The body lift is done by itself. Then the chest lift is done with the thigh lift. And in the third procedure, an arm lift is done. The gap between these procedures is typically around 3 to 4 months. This gap is important to allow the person to recover from a procedure before going in for another procedure. You might be asking, doctor, you're talking about removing skin. Doesn't this leave scars? Well, yes, it does leave scars. In the body lift, there is a long scar in the lower part of the abdomen that comes inside your underwear. In the arm lift, there is a scar on the inside of your arm. That is typically not seen, but if you lift your arms, it can be seen. In the thigh lift, there is a scar on the inside of the thigh. Most people are happy to live with these scars because it's a question of shape versus scar. All that loose hanging skin, it looks bad with clothes or without clothes. Scars are not seen with clothes, they are only seen when you take off your clothes. And even then, for example, the body lift scar is not seen even then also because it comes inside your underwear line. So, for an overwhelming majority of patients, these scars are an acceptable trade-off to have a tight fitting skin envelope and their body reflects how they feel on the inside. Now, how is the surgery itself done? Let us talk about the body lift surgery because that is the biggest of these procedures. This is a procedure that is done under general anesthesia. You're first put down on your tummy and then a strip of skin is removed in the back. Then you're put on your back and a strip of skin is removed in the front. The skin is pulled down and then stitched together. This is done under general anesthesia. You're typically admitted in the hospital for 1 or 2 days. After this procedure, it's important to look after this properly because there is a scar running all around your abdomen. So, you need to be careful with your position. You can't bend too far forward, you can't bend too far back because otherwise there is tension on the skin suture line and the sutures can open up. So, you should plan for at least 2 weeks to recover from this completely before you think of joining back to work. Usually within 2 to 3 weeks, most people are able to go back to work. In terms of resuming exercise, you can start exercising at 3 to 4 weeks. Usually by around 6 to 8 weeks, most people are completely normal. Now, the next question is that we often get is, doctor, is there any way to do this without surgery? There are so many advances with non-surgical techniques. Can anything non-surgical be done? Unfortunately, the simple answer is no. Non-surgical techniques are good for a little bit of extra skin. When you lost 30-40 kilos, that much loose skin, non-surgical treatments aren't going to help you. It's just going to be a waste of money. I know there are plenty of people promising you otherwise, but that is just the fact. This much loose skin, surgery is the only way to get rid of all of that loose skin. So, I hope this video was useful for you. Removing this loose skin, a body lift surgery is transformative for many patients. As I said, it is the final step of the journey. You have lost all that weight and now you want to look as good as you feel, and that this surgery can help you accomplish that. Thank you.